is that once you encounter questions that you have not seen, that one or two questions may seem a lot and may cause you to be distressed. Don't. Okay? Take your time, breathe, breathe. When you oxygenate your brain and you calm yourself down a little, right? And you start looking at the question and ask yourself, what is the question asking me? And apply your strategies. If you do that, I promise you, if you get a good course preparation, if you really put the time, you will succeed. Second thing is, you can do anything for a short period of time, right? You can put up a lot of things that you don't want to. You can work out intensively for an hour, maybe half an hour, 10 minutes. You can not go out for a year in order to save for the house that you want, or the car that you want. Obviously, you can't do that for a very long time. But my point is, when it comes to test preparation, I want you to walk in a test center feeling like a soldier. By the way, that's something that I really is ingrained in me. When I go to an interview, when I go take a test, when I go to war, when I go anywhere, I'm going to win that, right? So you walk there with the mentality. I'm not saying to be overconfident, but I'm saying how do you get the mentality is by doing the work beforehand and knowing that it is yours. Okay. So the third thing, this is something that I really, really believe is that the universe always says yes. I'm not going to pass. Yes. I'm not. This relationship that I am in is too good to be true, and is going to fail. Yes. Or you can say, I'm going to pass. Yes. I'm going to succeed. Yes. This belongs to me. Yes. I don't chase, I attract. Yes. Okay. So get in the mentality of only saying positive things towards you. Never curse about yourself. Never say that you are dumb. Never say you can't. Never say that's impossible. Work in the mentality of trusting what you learned, because isn't that true? You have gone through your BSN. Probably some of you guys who worked during that time. It is not a easy, I don't care where you went. Nursing school is not easy. I don't want to discredit other majors out there, but let's be honest, it's a lot harder than a lot of majors out there, right? So you conquer that, then you went to work as a nurse somewhere for probably a few years. You probably got married. You probably got kids. This is in general, right? General population we're speaking of. And a lot of things has happened to you. And somehow during that time, you said, I want to be a practitioner. I want to prescribe. I want to call the shots. I want to do better than what I see. And then you went to school. And guess what? Life wasn't easy either, right? You probably worked. For most of us, right? You probably worked. Not unfortunately for me, I didn't. I don't fall into the category. I was paid to go to school. That was my contract that I got. But most of you guys worked, and you still had a family, and you still had to pay mortgage and rent and things like that, right? But you made it through it. So the one thing that's separating you from your ultimate goal is passing this test. And that's why I say this is a war. This is a war. And don't take it lightly. Okay? Last thing before we start. If you are a first-time test taker, Do your best. Do your best. Prepare like a 3 months preparation. Prepare every single day so that you don't have to do it again. If you are not, if you're already taken and you didn't pass, that's totally okay. It could have been because something was going on in your life. It could be a financial issue that you're going through. It could be a death in your family. It could be so many reasons. But the most important one is it is gone. You got to let it go. And you have to start fresh. And this time, when you walk in a test center, you better believe that you will pass. You got to walk in there like, I know everything attitude. But be careful. Do the work. Study hard. We'll help you. We'll walk you. We'll be by your side. And this is what we really try to do at NP Exam Coaching. I'm not saying that we are perfect by any means because we are not. But I really enjoy working with my folks because they are my friends. They go out on all the time to say good things and even some criticism, and that's totally okay because I learned from that. Okay, so the final message is, guys, don't leave any stone unturned. We started this live course because only the recording portion, some people felt discouraged or felt I'm falling behind. I need someone to walk by your side, by my side. And I said, you know what? I'll do it. And sometimes I do have to wake up at 4 in the morning to give classes because I am in a different time zone. Right now, it is Thursday morning here, 7 o'clock in the morning. And when we do the crash course review this Friday with you guys, it's going to be like 4 in the morning for me. And I sure did not have to do that. I already sold the course. The course is sold. But why do I do it? Because I do care. Because every one of you guys is so important to me. Okay. And that, with that being said, this is where we're gonna start. And this is the first part of our crash course review. Now, I'm not going to go over all the crash course review. I'm going to go through the first part, which is the strategy, and the second part, which is some high-yield topics. It would be unfair that I give out this material for those students that are part of our course. Okay. Now, at the end, I'll do cover what our program is about. And if you like to enroll, that's fine. If you don't, that's fine too. And it doesn't matter if you don't enroll, it's okay. And you still have questions, you can ask me. I just cannot give it to you or be available to you as much as I'm available to the other students. Okay. So before we get started, there are a lot of people here. So if you don't mind raising your hand, if you have a question, please ask. Okay, we are doing this. We hopefully this is going to be about 2 hours, maybe 2.5 hours. But whatever we cover today, I want to make sure that you fully, fully understand whether you're in a course or not. Okay. All right. So part one is strategy. Then we'll cover some high-yield topics. Then I'll do a course offer for those that are here today. Okay. So let's get started now. So this is a roadmap. Everything we do in our course, there is the live portion and there is the recorded portion. The recorded portion you can watch at home at your convenience anytime you want. It comes with a PDF as well. Now, what's important about the recorded portion is what I call the Pomodoro technique. They are short videos that you can do it for 20 minutes, go get a cup of coffee, and come back. That way, your mind is refreshed and tuned up again for the battle that you're about to embrace. Okay? Because no one deserves to be on an online class for 6 hours. For gee, like, what are you going to get out of 6 hours sitting and pay attention to someone speaking fast, nonstop, and barely allowing you to ask questions? And that's because that is part of the crash course review. It's fast, right? And this is what I don't want. I want you to have the live and the recorded option. So when you come to the live class, you already watch the presentation. Now we can just go through your questions individually, each student. Not everyone will have a question, but then we can address the things that are still unclear, or maybe that I didn't do a good job and you want a better explanation, or maybe something that you didn't understand. Okay. Now, you're at the test center, okay? Your day has arrived. I would highly suggest that you arrive there early. When you receive your go, they're going to give you 2 sheets of papers, or laminated type papers. Make sure you get 2 brand new pens. You don't want to use the one. And you have to tell them. You may not be comfortable in telling them, like, hey, I want a new pen. I don't want this pen to fail on me. Then you sit down. You will have 18 minutes before the test start. What I like to do is center myself. I sit down. I take a deep breath. I close my eyes. I praise for gratitude for all the things that I have. Even the bad things are good things. All the time, no matter what. I live in a blissful state of mind that everything is good, no matter what, everything is good. So at that moment, I already know that this test is going to be good because everything is good. Take a deep breath. Once I'm done with that, I get those 2 pieces of papers and I do my dumping sheet. What is the dumping sheet? Dumping sheet is only the things that you have trouble remembering. For example, Erickson, stages of development. There are few of them. They can be complicated. There is age involved. There is failure, and there is successful passing through those stages. Something that you want to know. Inhibitors, inducers, medications that cause mania, medications that cause depression, and tons of acronyms that we cover in our course. You just may want to write down the acronyms there. You just may want to jot down quickly few of the things that you have trouble. Why is that important? It is very different, very, very different when you're doing question bank versus the real test. The real test is 175 questions, 3.5 hours. Question bank, you do 20, 30, 50, and that's it, right? So you want to make sure when it's question 160, they ask you something about Erickson, you be like, yep, this is the answer to B. I got it right here on my sheet of paper. Cannot just confirm what you already know and prevent doubt. Okay. So the first topic on our strategy will be covering objectives approach to a question. So how do you look at a question? How do you answer, analyze the questions? How do you prioritize what is important and what is not? About patient safety. What about patient safety? Everybody says patient safety is important. What about it? The importance of critical thinking also plays into our strategy here. Interprofessional collaborations and some cultural considerations in healthcare. And then we move on to high yield And at the end, I'll further explain what our process is, how we work. And if you would like to join us, great. If you don't, great as well. Hopefully you guys pass and we'll be here cheering on for you regardless. Okay. So the first thing is, how do you look at the question? Okay. So you focus on the information that's provided on the exam only. Don't add what you do in your hospital. I work for a federal facility that may do things different than a civilian facility. So if I judge what's right in my facility, I may be missing out on things that are important. So whatever is given to you on the questions, rest assured there is something in there that you should know. There is something in there that at least 75% of the people that have gotten that question got it right, unless if it is a test, a dummy question, right? So there is a treasure in the question, and you need to find out in order to unlock the results that you want, the correct answer. Okay, so only use what is written in the question, nothing else. Avoid making an assumption about extra details. Clear, right? Ask yourself, what is the core of the question? So here an example. A 15 years old recently died by suicide in the high school. All the students are concerned about this fact. Which of the following options or which of the following techniques would be most helpful to address suicidality in the community? What is the core of the questions? Can anyone tell me what is the core of this question? What
Suicide.
is the question asking about?
Talking about teaching for suicide
Where?
in the community.
Perfect, right? So the question, it's called a bait and turn here. So basically, I'm baiting you to believe this is about suicidality in the high school. And then the first option usually we put the one that's most attractive, that's not addressing the question. Ensure that you provide suicidality a survey or training to the high schoolers to address their emotional distress. Now think about this. That's pretty compelling. The question is about suicidality. The question it's about someone that's being hurt in a community, right? And then you kind of like your brain, you're so stressed, 175. The last questions, you just might pick the answer. But option D may say address suicidality by creating a podcast to decrease the stigma in the community, right? But a lot of people pick A. It may seem silly right now, this question, but I promise 50% of you guys will pick A because of suicidality in the high school. But the core of the question is how to decrease suicidality in the community. Okay. Now, another way that asking yourself what is the core of the question is, let's say the question it's about dopamine pathway. Okay. And asks in the mesocortical, the negative symptoms is due to serotonergic principles, right? Let's put this way. Well, you go, okay, serotonin, SSRIs, negative symptoms of depression. That makes sense. But it may not be the most prominent because this is about dopamine, not about serotonin. And it's about the dopamine pathway. So in the dopamine pathway, it is about the lack of dopamine in the mesocortical um, pathway there. Okay, so just be careful. So from now on, every time you read the questions, before you look at the answer, ask yourself, what is the core of the question? Summarize it. The question might be this big. Pick up the detail and say, the question is asking me this. And then already formalize the possible answer. And then you read A, B, C, and D. It seems like a long process, but if you are part of the question bank, you're practicing this every single day. It becomes second nature. Boom, boom, boom. This is how you operate. Read the question. What is the core of the question? Answer the question in your head. Now look for the answer that matches the question. Most of the time, almost always, will be an answer that's true, but it's not answering the question. So therefore, it is not the right answer. Are we clear on this topic? If not, please say so. This is your time to ask questions. Okay? Second topic, analyzing the answer choices. You said, hey, what is the core of the question? Now you have A, B, C, and D. Now process is a little bit longer. And trust me, this is a strategy. It does not replace this. Gee, I don't know this one. I'm getting a little flustered. Is it A or B? Strike through. There is a mechanism that you can strike through the wrong options at minimum before you move on to the next question. Because now you're approaching a minute and 10 seconds, a minute and 20 seconds, and you do not want to spend more than a minute and 30 seconds on any question. Okay, because if you are having a hard time, you should not steal the time from something that you may need later to answer another question. I have I have seen at least 10 different students telling me it wasn't that I didn't have the knowledge, Dr. Lopes, it's because I didn't work through it fast enough. And that is the reason why we do the diagnostic test, to work your knowledge and to work your timing. Now, you strike through 2 incorrect answers. Okay. Now you're going to look at disregard partially correct answers, as they're not the solution. They're not the true answer. So anything, especially with a dopamine pathway, the answers will be long. It may say in the mesolimbic, the positive symptoms of schizophrenia is due to an increase in dopamine. And in the tuberofundibular pathway, it's involved with serotonergic decrease in the area. So the first part is true, followed by and is not true. So therefore, that's not the correct answer. To be correct, the entire answer must be correct. Guys, I know this seems silly, but if you really think about those strategies and you start answering them in the question bank, you will succeed. Okay? Now, when two answers choices are completely opposed of each other, typical is example, hypo and hyperthyroidism in the answer choices, and something else is about whatever and whatever, most likely, if you don't know the answer, I would pick either hypo or hyperthyroidism, whatever that may be the case, okay? Because it's most likely one of the two answers. Again, this is technique. If you don't know how to answer the question, you have no clue, you came across a question like that, you could at least most likely will be one of those answers. Okay. You examine the question, stem, look at the question, and choose an answer that contains similar or synonymous terms, right? Oh, here said suicidality. The question involves suicidality here. I really don't know the answer. Then you could pick one of those as a way to get more or close to 50% chance. Because initially you have 25% chance. Now you want to get close to 50% at least. Again, is if you don't know the answer. Okay. Pick an answer that prioritize patient center of care, right? Here's already what I would suggest you to take, let's say, an SSRI suggestion. I'm giving the suggestion to the patient versus a TCAs. And the question asks which one is better for the patient, okay? That has major depressive disorder with suicidality, right? Better, it can be a misleading. What does it mean better, right? Does it most potent? Does it means recover depression faster? Or is it better for the patient, right? So if in the stem of the question, if it's for someone that has suicidality, you know that SSRIs or even SNRIs are much safer than TCAs. So that would be better for the patient, right? So you prioritizing patient care. Now, look for an answer what the patient wants to, okay? Because we have knowledge, we don't have a crystal ball. We are not, you are going to take this because this is best for you because research says it's best for you. That would be wrong. Hey, look, even if I have the best medication, I tell my patients this every single day. That's something that I do every single day. I give them choices and I explain what's my rationale for the choices. And I say, which one do you prefer? And almost every single time they say, you the doctor, pick it for me. And I say this by memory. Okay, I'm giving you choice because I respect your opinion. And the best treatment is nothing without you taking the medication. These are the side effects. These are the things that could possibly happen. And which one do you prefer? They feel empowered. They feel part of the team. They leave the office wishing to come back. Do you know that nearly 75% of the patients they don't come back after the first interview? That's a lot, right? So we have to put the patient at first. Okay. So if several answer choices are almost identical, they may be incorrect. Great example. Uh, if a question says about masturbation and touching, not really masturbation, but self-discovery of an adult, not adolescent, of a 5 years old looking body parts, that may seem weird. But if you've been through the classes and you understand that's one of the stage of development, right? According to Fyodor, right? You might pick that. All the other answers seems similar, but this one seems weird. You may want to pick the answer. Okay. Exercise caution in all absolute answer. Rarely anything in life, it's absolute always for certain 100%. Nothing that anybody offers you and says 100% guaranteed, I would be like, is it really 100%? Okay, so be careful. All, only, always, must, ever, never, everything. These are very strong words, right? Even in research, we should never say the research has proven X, Y, and Z. That's incorrect. Research doesn't prove anything. Research suggests, strongly indicate this is the best option, but doesn't prove. Okay? So be careful with all absolute answers. So generally, a medical evaluation choice is incorrect. Well, it makes sense. If you have to evaluate someone with a medical condition that you have to physically touch them, unclothing them, looking, very specific into it, that's a medical. We are therefore psychological, psychiatry, right? We deal with the mind. So if we have to look at something that's very, very medical in nature, then it's likely that we refer. However, before we say, let's move this patient to OB, to PEDS, looking for an answer that says, hey, let's collect lab and send the patient to the ED, rather than the patient needs to go to the ED immediately, unless if it's life or death situation. Ask yourself, is that something that I can do before I pass the buck? Because we're still part of the team. We shouldn't handily say, hey, here you go, doc, take over the care. No, it may not be a choice that says collect labs or set up an appointment. Even saying set up an appointment for the patient is something that we're doing, facilitating the care. Okay? And then we pass it on to OB, PEDS, or whoever might be the case. So we looked at the stem of the question, we looked at the answers. Now, that's two things that are critical for your success. Okay, now when we look at the answer, we prioritize what's really important, right? We're going to use critical judgment. Long are the days for all of us, because you will pass this test, that we pick an order, and I hope you analyze it before as a nurse, especially if you're a critical nurse, right? Before you blindly obey to the orders. But now you are the one who are writing the orders. So critically analyzing that, it's important. So the questions that contain key priority, initial actions, it looks at your ability to determine the most critical information to take at that moment. How do we do that? Well, it's not about first you assess, then you prioritize, and then you do your formulation. None of that. What's priority? Well, if you look at priority, right? Airway, breathing, circulation. Perfect example. A 35 years old male who has been recently divorced, recently cut his wrist, and he's highly suicidal, being admitted. You received a call from the ED about this admission to come assess the patient. What is, let's say the patient was taking lithium, right? And also cut his wrist and ingested some lithium pills. Let's just say making things up here. And then you come, and option A would be make sure that he does not have any lithiums medications on him to prevent further self-harm. That's important, right? Option B would be to take his vital signs. Option C would be to provide some education and further understand what caused the patient to become suicidal, right? So out of all these options, checking the vital is the priority here. Remember, airway, breathing, circulation is the priority because it says priority, initial action is what you must do. When it says priority initial action, you'll bring airway, breathing, circulation, airway, breathing, circulation, airway, breathing, circulation. Now, taking the vital is not there. Then you look at the Maslow hierarchy of need, the triangle that on top is like things like self-actualization, self-growth. In the bottom is the priority. Can you go home? You have recently been raped. Are you safe to go back home? Do you have a place to stay? Things of this nature are more important than assessing, diagnosing, providing treatment, providing medication. Now, if airway, breathing, circulation is not there, Maslow hierarchy of needs, you have food, you have shelter, you have security. Can you leave the house without being shot? Right? These are things part of Maslow. It's not there. Now, the first thing you do is assess. And here's the trick part. How do you assess? Well, I ask questions. Well, sure. But assessment here is different than assessment and intervention being a nurse. Do you assess by collecting data? Oh, so if I'm asking for labs, is that an assessment? Yes or no? Anyone?
Yes.
Yes. If the answer choice is looking at clinical research, is that an assessment? Yes or no?
Yes, it is.
Yes, it is, right? So these are assessments, but if you still have your nursing RA and BS in mind, you'd be like, oh no, I'm looking at the research, I'm doing implementation or whatever, right? It's different. Now you're collecting data. Anytime you collect data, it's an assessment. But you notice that airway, breathing, circulation is first, priority, initial action. Maslow is before collecting labs, for example. So just be careful. So these types of things are assessment. The third, using the nursing process. That's the nursing process, right? And the first step, it's always assess before intervention. Includes data, any type of data, right? You're doing also an assessment when you're collecting vitals, which could also be an indirect way of airway and breathing circulation. But collecting vitals is an assessment. Do you care about major depressive disorder, severe, with hallucination? When someone's blood pressure is 220 over 145? Hey, at that point, great. The patient is severely depressed with hallucination, but right now I care about his blood pressure. Let's start a admission for ICU, collaborate with the ICU internal medicine to get this patient admitted, drop his blood pressure down to a reasonable amount, probably I would say less than 140, and then we can admit this patient and take care of these other things going on. Okay, literature research and labs, things of that nature's assessment. So look at the question. What is the core of the question? looked at the answers, all those steps that we went through it, and if the question in the stem of the question says priority or initial action, airway, breathing, circulation, Maslow nursing process. All right, 3 things we covered so far. Let's move on. Emphasis on patient safety, right? Because the patient is the primary concern. Okay, so instance in which you say the patient was raped, let's say, God forbid, that's a horrible thing. Now the answer choice might be collect a collection kit to ensure that the perpetrator is caught. Let's say that way. You know, obviously, we wouldn't say so bluntly like that, but the answer choice is indicating, hey, you must collect a kit to collect evidence to prosecute the perpetrator, right? Sure, that's important, but it's not more important than, are you safe to go home? Do you know if the person has the key to your house? Can you be okay being alone tonight? That's more important, right? Now, if your mind is in, if you get caught up emotionally on the question, because that's something that we like to do too, get to involve in the feelings of the question, and let's get this most important. So immediate and appropriate actions is a priority for patient safety, right? So inpatient without relying solely on patient on safety contracts, right? That's a huge one. As in, patient agree by signing patient contract. If you've been a nurse for a long time, you know that's what we did in the past, right? So when it says patient contract, never. When it says patient uh, safety, right, which it's not a safety contract, is different. Okay. Do I have a question that I heard a blank? I do not have my open screen. So if anyone has a question, please ask.
I was wondering if it was just my internet because you're kind of splotchy going in and out, but maybe it's just mine. I'm sorry. Okay.
Has anyone experienced the same? Okay, so give me a second here. Let me open here my my internet better. Thanks for letting me know. Hopefully that gets a little bit better. Okay.
Yes, sir. Thank you so
Absolutely. Please,
much.
guys, this is important. Do not feel that you are stopping me. This is for you and for you only. Okay. So anytime you have a question, you don't understand, you something's in your mind, please ask. Okay. We'll stop and then we'll try to make it better. Okay. So you conduct an interview, for example. So that's one thing about rape that we just covered now. When conducting interviews, for example, patient safety, you want to make sure that patient safety also summarize as part of your safety as well. If someone is violent, if someone is aggressive, that's been reported to you that way, but the patient says, I want my privacy. I only want to talk to nurse X in my room to respect my privacy with a closed door. Well, that may not be the best for you. You are important. It's not only about the patient. So in that case, you want to conduct an interview in a semi-private setting. It doesn't mean there will be in open when everyone is around, right? That's not semi-private. It may be in the patient's room with the door open. It may be in the patient room with a second person in there, right? So you want to absolutely accommodate for patient privacy, but you also want to ensure your safety. Okay? Is the internet better now? Or not really?
Yes, sir. Much better. Thank you so much.
Okay. So in case of suspected child abuse, oh my, this one, it will get 50% of you guys, I promise you. This one is always a hard one, okay? Because child abuse, what first thing goes to mind? Close your eyes, I already know, call CPS. Well, is it true? First thing. No, it's not.
No.
Your job as an educated healthcare provider is to collect the evidence as best as you possibly can. So your first action is never to immediately call CPS unless if there's no opportunities for you to collect further data, guys. You are the cream of the crop. You are a prescriber. And I'm saying you are because you will be. So your job is not just, oh, I heard something, let me pick up the phone and call. This is not it. Your job is to collect more, further analyze the situation, help the system out. Okay? So, child abuse. Interview the child separately and report to CPS if necessary. Separately. When? When you think the suspect is part of the family, like the father, like the mother, the cousin that's with the child during that encounter. You want to separate them in that instance, okay? So you want to make sure that the child is able to give you the information, then call CPS, okay? So child abuse, a child playing with a sexually doll in some ways while you are talking to the parents, it doesn't mean immediately call CPS. It means it could be if no other alternative is given, but if there is a way that you can interview the patient first or find out more about it, that's what you do. Okay, your action is to collect more information and then call CPS. But in all instances, make sure the child is safe. Unfortunately, no answers would be crystal clear. It'll be muddy. But you have to put yourself in a position there you are the expert. Okay, even though you are starting your practice now, at minimum, you know to collect the information and then call CPS. When dealing with teenagers, establish trust and rapport by making sure you are respecting their confidentiality, not the parents, right? Unless their safety is at risk. How do you do that? Well, in the beginning of the interview, you describe what is the confidentiality. I very recently, I got off the hook on this one, not me precisely, but I had a patient that I described the confidentiality. This is not a teenager, but an adult. But the patient got very comfortable with me. And that's what I really want. But in the beginning, I tell the patient, hey, here's the confidentiality limits. These are the things that I can and cannot hold it back. At some point, something was revealed That wasn't right. I'm not going to describe everything. Then at that point, I had to start an investigation. Okay. At that point, I say, hey, look, you just told me X, Y, and Z. Would you like to tell me more about this? He said, nope, nope, I don't want to talk about it now. I'm uncomfortable. I said, okay, now I have to call the authorities on this. Okay. Obviously, I still want to give the patient the chance to clarify and tell me more about it, right? But at that point, if there is a safety risk, then I have to call the authorities on this case. Why do I say I got off the hook on this? It wasn't necessarily me, but the week before the trial, the person accepted the plead guilt and I didn't have to testify for a whole week, right? Because I would have been Monday through Friday testifying from 09 in the morning to 1600 military time, right? And of course, one lawyer will be like, "Oh, you broke confidentiality." The other lawyer, that's the defense attorney, will be like, "No, you did the right thing." And I'm right here in the middle, like, "Oh my God, what do I do?" And everybody's want to talk to me, like the entire month. I'm like, "Guys, I have to do work. Okay, I don't have the time for this, right?" So, but if it's safety and you have no other way to distinguish between is dangerous or not dangerous, then you may need to break confidentiality because a child might be at risk. Okay. Now, for teenager, back to teenagers, how do you deal with that? By explaining, I'm here for you, I care for you, and I will not tell your parents if you are dating someone of the same sex. If you are dating someone older than you, maybe by few years, not like 10 years, right? Not like an adolescent, an adult, or a 14 years old and a 25 years old male. That's not okay. Okay. But if you're getting someone that's a 14 and a 16, may or may not be okay. Okay. So I think some people would say the majority it's okay, but will be somebody that says not okay. It's a judgment call there. Okay. So by establishing there, you create patient rapport, confidentiality towards the patient. But something happens. If you are serving the patient, you're not entirely serving the parents that's paying for the bill, right? And that creates a dilemma between doing what's right for the patient and doing what's right for the family. Okay. So interviewing the patients, you always want to do it possibly together first, but then you want to do privately. And you explain this in the beginning of the interview. I said, hey, mom, hey, Jackson, I'm so glad to meet you guys. You are here today. Let's discuss what is going on and how we can help you or possibly give you alternatives. And then probably in the middle of the interview, I'll ask mom to step out so I can have some time alone with you. Is that okay, Jackson? And then when that happens, then I say, Jackson, I'd like you to wait in the living room. Let me speak to mom privately. I do the same thing for both. This is how I usually operate. But I discuss this in the beginning of the interview. But when I'm with Jackson alone, I say, look, if you are doing X, Y, and Z, and it's not like outrageous, I'm not going to tell your mom. Rest assured. But if you are committing these types of offense, I must take action. Okay. So, for example, when if she or he is having sexual attraction to someone of the same sex, or they are dating someone of a different age, right? You may want to keep the information confidential. They have the right to confidentiality, but not the right for privacy. Some people get confused about this one. So let's break down right of confidentiality, but not the right of privacy. Remember the case when they said someone is violent and they may not have the right for privacy because privacy is under your safety and the patient's safety. But they have the right to confidentiality. So you don't go around and discuss that case, that name in the elevator. So that's confidentiality. The privacy is the privacy interview portion, right? So you want to provide privacy, but that's not an inherent right. Are we clear about confidentiality versus privacy? And the patient always has the right to confidentiality, but not every single time to privacy. Are we good on that? Because that topic always got people confused. Okay, we went over stem of the question. We cover how to analyze the answer. We cover priorities, and then we just emphasize on patient safety. Now, the last topic here is the importance of critical thinking, okay? Understanding the reasons behind the clinical decision, particularly for diagnosis and tests. There are certain labs that you must know, like thyroid, you gotta know that, right? Some very ANC, you gotta know that, right? So you have to use your critical thinking. Now, if you come across a lab and God forbid your brain is fried that day, it will not happen to you because you study hard. But if it did, and you didn't know what the lab is, then it more likely than not, you assume the lab is incorrect. If they're giving you a lab and it's something that you never heard of, especially, assume it's high and probably dangerous. Okay? Again, this is a strategy. It's not a surefire, always right. Because nothing in life is always. Nothing in life is 100%. Okay? So if you come across questions and specifically answers that involves other modalities, other service, right? That may be the right answer. It's so fun. I did a job interview 2 days ago and they asked me this question. How do you deal or how do you interact with our colleagues with in the ICU, the ER, and so forth? I said, well, that's a great question. You know, that's my bread and butter. Collaboration is important, right? So you aim to actively involve patient care, right? The patients, they involve the patient in the decision rather than delegating them. Medical model, nursing model, right? A patient center versus this is what you do. Collaborating the work with the nursing manager, dietitian, and the nurse supervisor is essential, but not to delegate to them. Hey, nurse supervisors, you must ensure that the patient does not eat over 500 calories of food, right? So you may want to, hey everyone, do you mind if we have a 5 minute huddle here to address the problem? I have noticed that I have written an order specifically that the patient's only allowed 1,500 calories because I am prescribing antipsychotic and the patient is at risk for metabolic syndrome. However, I noticed that the patient is eating 5,000 calories. Can anyone mind trying to understand, help me understand what's happening, right? So I'm collaborating with the team rather than saying, hey, nurse, you cannot do this, X, Y, and Z, right? So be clear on that. Collaboration is the key, especially with OB. Well, if you see OB on the question, collaborating, man, that sounds so good right away. Not always, right? In case such as postpartum suicidalities, right? Edinburgh scale. collaboration with the OB department is necessary before discharge. Maybe do a PHQ-9, maybe do some assessment. Hey, you just had a baby. We understand that postpartum depression is dangerous and is very significant. Here is a survey, a scale to do before you discharge. If the scale is positive, please book an appointment with the patient in our office so we can further collaborate on the patient care post discharge. Okay. In case shortage of postpartum, we just mentioned that, right? So very important. PEDS is another one that's very important. So ensure the informed consent is obtained when transferring patients information or making a referral. For example, when patient requests a transfer of their health care. Dr. Lopes, I am being admitted for alcohol maintenance issues, right? Alcoholism to X facility. So you are now going to need a informed consent. How many? And the patient has major depressive disorder. How many informed consent do you need? 1, 2, 3, 4, or 5? Anyone?
2.
2, right? Anytime you have a substance disorder plus a psychiatric disorder, you need 2 informed consent. Here is transferring the patient record is the core of the question. Then you ask yourself, how can I securely do this? By using a fax, by using a fax straight to the facility rather than hand carrying with the patient. Very clear on here? Okay, so you do a fax rather than say, hey, John, here's your medical records, have a good life, right? Then the appropriate choice is to fax the patient medical record to the receiving facility rather than delegating the patient take your medical records by hand. 2 informed consent, always for SADS and psychiatry disorders. A good one, faxing the patient information to the pharmacy. Is that a option 1, failure of informed consent, or is it of confidentiality? This one always get people. If I fax the patient information to the pharmacy and after explaining the procedure, is that a confidentiality issue or just informed consent? Anyone care to guess the answer?
Informed consent.
Anybody disagree? Okay, perfect answer, but it's incorrect here. Confidentiality is above informed consent. What you did, it was a break of confidentiality, right? So it's kind of like which one came first, the chicken or an egg. But in this case, if you faxed, and pay attention to the question, pay very close attention to the question because the 2 answers are very, very, very similar. But usually when you're faxing something without the consent, it's a breakage of confidentiality. It's think about dispersing information out there in the elevator. Let's say that I'm talking about the patient case in the elevator. Is there confidentiality or is informed consent? Now it's more clear, right? That's a confidentiality. So how is it different than sending the same patient information to the pharmacy. It's a break of confidentiality. Please write that down, because that's like a 50-50 percentage that you may get a question like that. That is incorrect. So that's a break of confidentiality. Okay. It's one of those, ethical dilemmas when asking about autonomy. Pay attention. Is it about patient's autonomy, or it's about your autonomy as a practitioner? Okay. Most of the time is referring about patient's autonomy. But one of the answers will be about your autonomy to pick the right option, the right medication for the patient. And it will sound so good. But the question is about the autonomy of the patient. So confidentiality and informed consent, they're kind of almost the same. But confidentiality is a breakage of confidentiality. Sure, it was because you did not get informed consent. Okay? But here, what you did first, it was a break of confidentiality. Okay? Consider what can be done to the patient before making a referral. I think we covered that. That's pretty clear. Like screening. If the teenager has tested for acetone to rule out other substance use disorders, right? If someone comes back as positive or high, and you want to order a test before immediately saying you are going to the ED. Okay. One of the last points here, so we can close the strategy and take a 5 minutes break, is cultural consideration. Super important in what we do. Remember, your job is to really understand where the patient's coming from and understand what is right for the patient, individualized. Not everyone that's from Africa are the same. Not everyone that's from Brazil is the same. Not everyone that comes from Mexico is the same, or from the US is the same. Okay? Always choose an answer that reflects cultural sensitivity. If they have a different way of living or of being than what you would see in the US. So what am I talking about? The question would say a 35 years old male from Bolivia or from Brazil. So right there is telling you this is a cultural question. And one of the things you probably want not to do is say, research highly suggests that SSRIs is effective for major depressive disorder. So remember, previously, I said, be careful with true statements that does not answer the question. A better answer would be, tell me how you feel. Tell me how patients of your country or tribe or region deal with feeling sad. Right? So the first answer is very specific. It's very, very much what we know is a strong answer, but it's a bait. Right? It wants you to go there because it's thinking you're not ready to practice because you're too black and white, when life is never like that, right? So do not equate, do not put an equal sign of what's cultural influence response in mental health. If in my country, I'm from Brazil, if I wake up at 1 in the morning, go for a jog, that is what my country do, which by the way is not, right? But if I tell the nurse, if I tell the provider, this is what we all do in my tribe, where I came from, that is not a psychological, psychiatric problem. This is what we do. Although it's different than what you do from where you came from, it's not a psychiatric condition. It's not insomnia. Okay? It may seem weird, but it's okay. That's what the patient do. That's what's normal for them. It's not for you to be critical about it. Okay? Clarifying the meaning. Hey, do you mind better educating me why waking up at 1 in the morning going for a jog is important to your culture? That might be the answer, right? I'm seeking clarification of something that I don't know. And that's totally okay. If I don't know, I'm asking, help me understand so I can better help you. So you want to put it yourself at the patient's shoes and say, hey, is this normal or is it abnormal? All right. So you want to empower the patient by understanding their perspective and validating the symptoms within that tribe, that country, their culture, within their overall world, where they're coming from, their framework, right? For example, very important, mal de ojo is something that we see there in Mexico or from Hispanic cultures. Oh, my child is sick because my neighbor is jealous of how cute he looks. And for that reason, I'll wrap a bracelet on his left arm. Let's say that's the problem. So the evil eye is the problem, right? Instead of, and the patient presents with fever and maybe labs is a little bit wet, not critically, but a little bit wet. Your job, option number one, will always almost be ensure that the patient has the right antibiotic to care for this infection, right? So let's say white blood count is elevated, patient is feverish. It sounds appropriate, but because it's a cultural question, the better answer would be very hard to pick, right? Please, please help me understand what is evil eye. How does it affect your child? Versus this antibiotic has been strongly suggested by research to be helpful for this type of infection. Another one, the patient has bruises all over his arm, and on his tribe, his country, wherever he's coming from, rubbing a leaf on his skin is what makes it better. And you go, geez, that's going to cause an infection? That would be the wrong answer. The right answer is, help me understand, what does it do for you? Please allow me to be on your shoes and teach me about it. Be humble about it, right? You don't know what it is, so don't pretend that you do know. Okay? So these things are cultural sensitive answers. They are difficult because, correct me if I'm wrong, where you went to school, did they teach you things like that? I I mean, sure about culture, but not specific to not providing antibiotic when they see an infection, right? So this is the core of the nursing, is the holistic approach, is it like what we do is towards the patient center of care, right? So it's very specific to testing. All right, guys. So as you know, I do not like to give a long lecture because taking the time for you to understand is way more important than spending the next 20 minutes, half an hour, 1 hour. Most important part is you. So that being said, what we're going to do, we are going to take a 10 minutes break. We'll be back at 7:30 Eastern Standard Time. We'll answer some questions and start on part two of the Simplify PMHNP by NP Exam Coach. Then I'll see you guys in 10 minutes, and then we'll answer some more questions. See you guys then. Go for a walk, bathroom break, do some push-up, and come back so we can learn some more. Okay, bye-bye.